Hello and welcome to your update on the COVIDENCE UK study for February 2022. My name's Adrian Martineau and I'm the Chief Investigator for the study based at Queen Mary University of London. Now today, once again, I've gone into the COVIDENCE inbox to see which of your questions are the most frequent. And in the last month, a number of questions have arisen, all relating to the effect of booster doses of COVID-19 vaccines. So I thought that for today's webinar, I would focus on three of those questions and present to you our latest data on the effectiveness of booster doses of vaccination in the COVIDENCE UK cohort. So the three questions I'm going to address are as follows. The first one came and said, I didn't have any antibodies after my first two doses. Can a third dose do the trick? The second question we're going to look at is, what are the risk factors for getting COVID after having a booster jab? And the third question, which booster offers the best protection against COVID-19? So to start with the first of these questions relating to whether or not a booster dose can produce antibodies in people who did not have them after their initial two doses of COVID-19 vaccination. Now, those of you who've watched these webinars before may remember that our previous antibody study, which was done after two doses of vaccine, showed that around about 4.2% of people who took part, and there were around 11,000 people who took part in that study, had undetectable anti-spike antibodies after two doses of vaccine. And we can break that down looking at the two major primary courses of vaccine, AstraZeneca and Pfizer. And you may remember that the proportion of people who didn't have antibodies after their initial course of vaccination was higher among those who had AstraZeneca, that's 5.8%, and lower among those who had two doses of Pfizer, 1.2%. So the question we then wanted to ask, going down the road and looking at the effect of boosters, is can a booster dose generate antibodies in people who had none detectable after their first two vaccine doses? So the design of the study was as follows. We invited everybody who had undetectable antibodies after two vaccine doses and 100 people who had detectable antibodies after two vaccine doses to give an additional dried blood spot for testing antibodies after booster. For 154 of those people invited, we didn't have results available at the time of making this presentation, leaving 247 of the group who had undetectable antibodies after two doses and 57 of our positive controls who did have antibody results, antibodies after their first two doses. And just to break these down a bit, in the group who didn't initially have antibody responses to two doses, 201, the vast majority of them had had two doses of AstraZeneca and then went on to have one dose of Pfizer. 24 had two doses of AstraZeneca and went on to have a booster of Moderna, and 22 had Pfizer for their primary course plus a Pfizer booster. Of those in the positive control group who did have antibodies after their first two doses, 20 had AstraZeneca plus a Pfizer booster, 19 had AstraZeneca primary with a Moderna booster, and 18 had Pfizer primary with a Pfizer booster. So here are the results. First of all, let's look at the commonest vaccine combination, which is to have two doses of AstraZeneca for your primary course, followed by a Pfizer booster. Here you can see the results from the positive control, showing that if you do have antibodies before your booster, then those antibody levels climb after the booster. So the booster is having its desired effect in boosting immunity to coronavirus. But what about those people who didn't have antibodies after their first two doses? What you can see is some really exciting and promising results from these data. So of the 201 people who had undetectable antibodies after their first two doses, 197 of them, that's the vast majority, went on to develop antibodies after their booster dose. So that's 98% of people who didn't have antibodies after two doses of AstraZeneca went on to develop them after having a Pfizer booster. So the Pfizer booster was really effective in generating antibody responses in people who didn't have them after two doses of AstraZeneca. Let's now look at the second combination, which is two doses of AstraZeneca for the primary course, followed by a Moderna booster. Again, here are the data from the positive controls, showing that in those who had antibodies after their first two doses, the Moderna booster was effective in elevating those further. Here are the data for people who didn't have antibodies after their first 2 doses of AstraZeneca. And you can see that all 24 of these people went on to develop antibodies after receiving a Moderna booster. In other words, 100% of those who didn't have antibodies after 2 doses of AstraZeneca did go on to develop them after having a single shot of Moderna. Finally, let's look at the third combination, which is people who had 2 doses of Pfizer for their primary course, followed by a Pfizer booster. Again, you can see from the positive controls that the booster was effective in elevating antibody levels in those who had detectable antibodies after 2 doses. And in the 22 people in this group who did not have antibodies after their first 2 doses of Pfizer, all but 4 of them went on to develop antibodies after their booster dose. In other words, 82% of those who didn't have antibodies after 2 doses of Pfizer went on to develop them after a Pfizer booster. So a lot of data here, but what's the bottom line? Well, overall, 96.8% of people who didn't make antibodies after their first 2 vaccine doses did go on to make antibodies after their booster dose. And this shows that the boosters are highly effective in generating antibody responses, even in those who didn't have antibodies after 2 doses. Of the 8 people we studied who failed to make antibodies after a booster dose, they either had an immunodeficiency disorder or they were taking immunosuppressants. Now, that is not to say that these people don't have any protection at all. And one of the key things to note about this study is that we didn't measure T cell responses, obviously because they can't be done on postal dried blood samples, unfortunately. So if you don't have antibodies, it doesn't necessarily mean you've got no protection, because you could still have T cell protection. But overridingly, the boosters were very effective in the vast majority of people at generating antibody responses. What about the second question then? What are the risk factors for getting COVID after a booster jab? Well, here's the design for this study. What we did was we looked at everybody who responded to our questionnaires and said they'd had a booster jab. And then we followed them up and used your responses from the monthly questionnaire to divide people who'd had a booster jab into 2 groups, those who went on to get COVID-19 after their booster and those who didn't get COVID-19 after their booster. We then look back at the information you provided again in the monthly questionnaires and the baseline questionnaire to compare the characteristics of people who did or didn't get COVID-19 after their booster. And this allows us to look at risk factors for getting COVID-19 after a booster jab. So the people involved in this study were 11,382 of you, an average age of 64 years, 70% female, 30% male. And in terms of the vaccine regimens represented, the commonest again was 2 doses of AstraZeneca followed by a Pfizer booster. The next most common was 2 doses of Pfizer followed by a Pfizer booster. And then 12% had 2 doses of AstraZeneca followed by a Moderna booster. And the remaining participants had some other regimen. So what were the numbers? Well, as I've said, 11,382 people were participated in the study. And of them, 697 or 6.1% went on to get COVID-19 after they had their booster jab, whereas 10,685, that's 93.9%, did not experience COVID-19 after their booster jab. And I should add that the amount of follow-up is relatively short. It's an average of 8 weeks, with about 80% of people having follow-up between 4 and 12 weeks. Now, one really important thing to notice here is that although 6.1% of people did get COVID after their booster, only 2 of them were hospitalized. So we can say with a high degree of confidence that booster jabs are very effective in preventing severe COVID-19, even if you do get some non-severe breakthrough disease. Further risk factors for getting COVID-19 after the booster jab. Well, first of all, we looked at people's basic demographic characteristics. And the first thing we looked at was age. And here we got a surprise, because it's commonly recognized that older people tend to have less vigorous immune responses to vaccination. But what we saw was that people aged 65 years or older had a 42% lower risk of getting COVID-19 after their booster dose than the under 65s. So let me show you the primary data. This is called a cumulative hazard plot in case you're interested. But basically what it shows along the horizontal axis here is the number of weeks since you had your booster. And on the vertical axis, it shows the proportion of people who experienced COVID-19 after their booster. And the red line here represents people aged 65 years or more. And the green line represents those aged under 65. And what you can see is that the under 65 line, the red line, trails well below the green line, indicating a reduced risk of COVID-19 after booster in older versus younger people. For the statisticians out there, the adjusted hazard ratio is 0.58. Now, one obvious explanation for this is that people who are older may be having less social mixing. They may be more concerned about severe COVID-19 than younger people, and this might explain why they're getting less COVID-19. But we did try and adjust for this. In fact, we adjusted for no fewer than 13 potential factors which could also influence risk of COVID-19, and these include people's age, their gender, their ethnic origin, occupation, whether or not people are retired or working in a frontline job or an office job, body mass index, so whether or not people are overweight, household composition, so whether there are people of working age or school-age children in the household, the number of visits people make to each other's households, the number of times people use public transport each week, the number of times people visit indoor public places like cafes, libraries and pubs, and underlying medical conditions. And even after adjusting for these 13 factors, we found that age was associated with decreased risk of breakthrough disease after having a booster dose. So it's a really interesting finding. One possible explanation could be that people who are older may be less likely to get symptoms when they have COVID-19. Therefore, they don't test, and therefore they're not coming up in our data. But it is a very interesting finding and quite significant, I think. While we were looking at people's basic characteristics, we also looked at ethnic origin. And in contrast to all our findings from the pre-vaccination era, when we found that people of Asian origin or Black origin were at increased risk of COVID-19 compared to people of white ethnic origin, having a vaccination reduced that, or basically eliminated that ethnic difference in risk. So there was no ethnic difference in the risk of getting COVID-19 after vaccination, which is a big contrast to what we saw before vaccination. So again, I think a really important null result there. Along similar lines, another risk factor that was really important in the pre-vaccination era, namely being overweight, was a risk factor both for getting infection and also getting severe disease. Once you've had your booster jab, our data suggest that the increased risk associated with being overweight is basically cancelled out by having the booster jab. So again, really encouraging message showing that the boosters are working well, and an important null result. After looking at risk factors relating to people's characteristics, we then went on to look at a number of risk factors relating to people's behaviour. I mentioned that we looked at whether or not people of working age were in the household. And what we saw was that if you had somebody of working age going out to work in a given household, then the other people in the household were at a 40% increased risk of getting COVID-19 compared to households where there wasn't a working age adult. And presumably this relates to contraction of COVID-19 in the workplace and bringing it back to the household where it can then be transmitted. Along similar lines, we saw that the number of visits to indoor public places was highly correlated with people's risk of getting COVID-19 after their booster dose. To put a number on it, there's a 54% increased risk among people who went to an indoor public place, such as a shop, a cafe, a library or a pub, more than 3 times per week versus those who didn't visit such a place during the previous week. Talking of pubs, alcohol was also associated with an increased risk of getting breakthrough disease after the booster dose, with a 37% higher risk for people drinking more than 15 units per week as compared with those who didn't drink any alcohol in the previous week. While this may relate to social mixing, as I said before, all of these estimates are adjusted for our best estimate of how much social mixing people are doing. So this may also represent an effect of alcohol on the immune system. And here's another cumulative hazard plot just to illustrate to you the association between the number of visits to indoor public places and your risk of getting COVID-19 after your booster. So the green line here represents people who didn't visit an indoor public place in the week prior to completing their questionnaire. The red line represents those who visited an indoor public place once or twice in that week. And the blue line represents people who visited an indoor public place 3 or more times in the week before their questionnaire. And you can see there's a clear dose-response relationship with the more times you go to an indoor public place, the more times, the more likely you are to get COVID-19 after your booster jab. What's the bottom line in response to the second question? So overall, 6.1% risk of COVID-19 after people's booster over an average of 8 weeks of follow-up. Really important to highlight, though, that the risk of getting severe disease after a booster is infinitesimally small, just 0.2% or 2 in 10,000. So if you haven't got around to booking your booster jab yet, I would encourage you to do so because it's super protective against severe disease. One really intriguing finding that we need to understand more is that older people were at lower risk of COVID-19 after their booster jab, and that's perhaps the opposite of what we might have expected, given what we know about older immune systems being less reactive to vaccination than younger ones. Another really important finding was that being of Asian or Black ethnic origin compared to being white, or being overweight compared to being non-overweight, was no longer a risk factor for getting COVID-19 once you've had your booster. And this is a big contrast to the pre-vaccination era. Finally, I think another important take-home message is that factors related to coronavirus exposure, such as having working age adults in the home, going out to shops, and similar factors such as being a frontline healthcare worker, will still affect risk even if you had a booster. So the booster doesn't make you completely resistant to disease, and these factors which influence your risk of getting exposed to SARS-CoV-2 still play into your overall risk of getting infection after your booster jab. So the $64 million question, I guess, is which of the boosters offers the best protection against COVID-19? And as you'll know from the earlier slides, we have basically 3 regimens well represented in the cohort. We have a group of people who had 2 doses of Pfizer for their primary course, followed by a Pfizer booster. We had people who had 2 doses of Oxford AstraZeneca, followed by a Pfizer booster. And a third group of people who had 2 doses of AstraZeneca, followed by a Moderna booster. Now, the lowest risk of getting a breakthrough disease, again, after adjusting for all these 13 confounders in our multivariable model, was people who had had 3 doses of Pfizer. In comparison to that group, people who had 2 doses of AstraZeneca followed by a Pfizer booster had a 24% higher risk of coronavirus infection compared to those who'd had 3 doses of Pfizer. And those who had 2 doses of AstraZeneca followed by Moderna had a 44% higher risk of coronavirus infection after their booster as compared with double Pfizer followed by a Pfizer booster. And just to close up, here again is the plot to illustrate how those effects look. So you can see there the blue line at the bottom represents those who had a Pfizer primary course followed by a Pfizer booster. The middle green line shows those who had 2 doses of AstraZeneca followed by a Pfizer booster. And the top red line shows those who had 2 doses of AstraZeneca followed by a Moderna booster. And you can see the shaded area outside of these lines represents what we call a 95% confidence interval. That basically means that we're 95% sure the risk lies between these outer margins here. And where you see clear water or white color between the lines, that means there's a statistically significant difference. So you can see that the double Pfizer is statistically significantly better than the AstraZeneca followed by Pfizer and the AstraZeneca followed by Moderna, but there's some overlap between those latter 2 categories. That really represents the relatively short follow-up we've got and the relatively small numbers we've got in the, particularly in the AstraZeneca and Moderna group, which limits our statistical power to separate them at the moment. But with more data, I suspect that we will be able to tighten those 95% confidence intervals and say that these are going to be statistically significant differences, just looking at the way the data are going. So the bottom line for this part of the presentation is that of the 3 vaccine regimens studied, a triple Pfizer offered the best protection against coronavirus infection. But it's important to note that this study is based on relatively short follow-up, a median of 8 weeks. And really important to note that all regimens are highly effective in preventing severe disease. So if you're disappointed with the regimen that you had, don't be, because we know that all 3 of them are really good at preventing against severe disease, which is the primary purpose of getting vaccinated. So that brings me to the end of today's presentation. A number of people I'd like to thank who contributed to it. First of all of you who took part in both of the studies. Thank you for doing the blood spots. Thank you for carrying on completing your monthly questionnaires. The information you give us is super valuable, and we'll continue to analyse it and bring you updates every month. In terms of the antibody study, David Jolliffe at Queen Mary and Sian Faustini and Alex Richter at the University of Birmingham made key contributions. And the analysis of breakthrough disease after booster doses was done by Julia Vivaldi here at Queen Mary as well. I'm also grateful to our funders, Bart's Charity, Fisher Family Trust, Dangor Education, and DSM Nutritional Products. And finally, thanks for watching, and look forward to catching up with you again next month. Goodbye.